Good afternoon, everyone. My name is Dr. Wanda Barfield, and I direct the Division of Reproductive Health at the Centers for Disease Control and Prevention here in Atlanta. I'm sorry that I can't be with you in person today. However, I'm very pleased with the opportunity to share in the celebration that you're having for a remarkable person, Dr. Marie McCormick. So you may see in my office that I have some photos of my children and family. And Marie, I just wanted to let you know that these boys have grown up. Marie knows my sons, both Joseph and John, and probably the last time she saw them, they were quite tiny, but they're now quite large young men, with my oldest son now being 6'3", including the hair, and John is probably now taller than Marie. But they send their greetings, and I just wanted to share that with you. But I think one of the things that's very important is that Dr. McCormick has meant a lot to me, both personally and professionally, and I think many of you would agree that she has made remarkable progress for us all in the field of public health and in maternal child health. And although I just have a few minutes with you, that will not aptly describe all of the wonderful things that she's done for maternal child health, but I'm certainly going to try. So I want to forego a more formal presentation, of science and data to really talk about how Marie has been a truly remarkable, illustrious, eminent, amazing, impressive, talented, celebrated person in the area of maternal child health. And although all of these attributes describe her very well, I just want to talk about what I think are 4 fairly succinct attributes that really describe the work of Dr. McCormick over all of this time and how special she's been to all of us. So, as you know, Dr. McCormick's pedigree is very impressive. Emmanuel College, Johns Hopkins University, and the Johns Hopkins Hospital, where she did her medical training as well as her clinical training. She has done immense work in the field, and when she came to Boston in 1987, she was an associate professor of pediatrics and the director of the infant follow-up program at Boston Children's Hospital. In 1992, she then was selected to be the chair of maternal and child health at Harvard School of Public Health, and then she later held that position from that time until 2003, when the program was then combined into the Department of Social and Behavioral Sciences. And this has been a strong program with funding in maternal child health for now over 60 years. I just say that all to say that we know that Marie has been wicked smart. Now, Anton Chekhov would more keenly say, knowledge is really of no value unless you put it to practice. And put it into practice she did. So Marie has been internationally recognized for her work on the outcomes of high-risk infants, particularly preterm infants. And she's really looked at evaluating programs and these infant outcomes. She was the co-principal investigator in a demonstration program that assessed the effects of regionalized perinatal services, and that has greatly contributed to the reduction in infant mortality. I think one of her most important roles, and maybe actually one of her more challenging and maybe even somewhat dangerous role, was her work on the Committee on Immunization Safety. But that work was really important, and it was one of the things that I really respected around Dr. McCormick in terms of her personal integrity to really demonstrate the evidence. And what that evidence found from that committee was that there was really no association between immunizations and the risk of autism. And it was an important landmark work that committee did, but again, amidst all the controversy, it was also very, I think, personally challenging. But again, a really important opportunity to show how important data and evidence is in improving the health of children. She also continued her work on the National Vaccine Advisory Committee, where she chaired work to look at the safety of the 2009 epidemic of H1N1. So it's really to say that she's been really, truly a pioneer, and that she has not been your regular doctor. So she's also been committed in the influence of the field in MCH in particular, and it's just to say that Marie has been a real ma to MCH. And when I say true to MCH, she has really shown her dedication through over 30 years of work to sustain and advance the discipline of MCH through both evidence as well as science. You know, she has been so incredible in her vast understanding of the field. She understands the players, she understands the influences on the system, she understands how these issues interact so completely that there have often been times where I've reached out to try to talk with her about a very difficult challenge, and she's been very easily able to put many issues into context to help me to identify who are the leaders in the field and where's the current state of the science, so that it has helped me, particularly in one area such as teen pregnancy, to really understand where we needed to do and where we needed to go in terms of moving forward as a division and ideally as an agency. I also wanted to talk about, finally, the fact that Marie makes a great chowder. And I don't mean like a chowder in the sense of, food, but although I think that, given that she's lived in Boston for 30 years, that she probably could whip up a good chowder. But I mean, she has contributed to the rich diversity that's like a chowder in terms of the work of MCH. She has mentored and supported a diverse cadre of MCH experts, from students and the work that she's done with the Biomedical Sciences program through Harvard Medical School, to the training that she is doing currently with clinical fellows in the work with the Beth Israel Hospital and the Harvard epidemiology work, as well as the work that she's currently doing with many at the School of Public Health. And I would say that that legacy is spanned generations. And it's been so wonderful not only to learn from her, but to also see the generation of young scientists that she has helped to foster, who are now distributed throughout the country and internationally. And I'm really proud to say that I'm a part of that legacy. So I just want to conclude and say that Dr. McCormick's legacy has influenced our daily work at CDC. The work that we're doing on a system called Locate has been influenced by her pioneering work in MCH and perinatal regionalization. The work that we did with respect to teen pregnancy has also been greatly influenced. The work that we're doing to understand maternal mortality and the Maria system is another area where we've had an opportunity to work with Marie. Some of it directly, some of it indirectly, but she's really made great contributions in this area. In addition, she's given us an opportunity to build capacity more broadly through MCH evaluation and in the collaboration with the MCH Epidemiology Program, or MCH-EP. The Maternal Child Health Epidemiology Program consists of 14 state-based MCH epidemiologists who work vigorously to build capacity at the state and local level, to build data, to help that data in terms of making sure that we're doing work that's applied but yet based on evidence, and also to help with peer exchange opportunities. As I mentioned, we have 14 assignees who are based, and the photo that you may be looking at now are our current assignees, as well as those that support them in our Atlanta-based team. So finally, every January, when it's way too cold in Boston to really be there, we have what we call our annual maternal child health evaluation program, or Harvard Practicum. And it's a practical program that's done during the winter break to evaluate MCH programs here in Atlanta. The students and their state program liaisons come each year to meet in Atlanta. They determine an opportunity to evaluate a program, and then they actually spend time in the state conducting the evaluation and providing a plan for the states. This has been a great practical experience that's been very well received by states, because as many of you may know, there are a lot of great programs in MCH, but sometimes we're limited in our capacity to evaluate these programs. And again, each January, students, the fellows, our assignees, as well as our MCH staff from states come together for this evaluation. And if you see the picture here, we can see that these were last year's participants. Also, another colleague who's from CDC, Dr. Mary Brown, who leads the Healthy Homes Initiative, has been involved in this activity with us. And actually, it was an initial activity that happened with lead, but then due to some issues with regard to cuts, it was then expanded and combined with the MCH epidemiology program, and it's really been a huge success. Also, I just wanted to add that 2 weeks ago in Portland, Dr. Marie McCormick received the prestigious Zena Stein and Mervyn Susser Award for Lifetime Achievement in Maternal Child Health Epidemiology at the 2018 MCH Epidemiology Awards Luncheon. And this award is notable for either an individual or a group of individuals who have made substantial differences in the field of maternal child health epidemiology. And we were really excited to give this particular award to Marie. And as you can see from this picture, there were many there who celebrated that achievement. So Marie, I just wanted to let you know that you have created a legacy that will continue across generations, that include physicians, public health researchers, epidemiologists, scientists, and others who are working in both clinical medicine and public health. You are definitely deserving of this highest award, and we also want to congratulate you for your achievements over these years in MCH. So I just want to thank you for your contributions and all that you've done for maternal child health. And I hope that you have a wonderful day celebrating with friends and colleagues on this momentous occasion. Take care, and we'll talk again soon. Bye.